So I'm just trying to share my screen. Please let me know if you can see something.
Yes, we can.
Yeah, we can see. Yeah, it's visible.
Good. Okay. Thank you very much. First of all, I want to thank NAMP again for thinking that I can serve them well or serve us well in the role of the chair of the Clinical Training and Certification Board. So we've been working for about a year now. And so what I'm going to be talking about is based on what we've done so far. We have a group of people working together, and we have an Australian colleague who has done a lot of work for us. So what I'm doing is going to be giving you snippets and snapshots of what we expect that will be happening when you think about being clinically certified. Now, as I thought about how to do the presentation, I thought I'll be getting lots of questions. And it would be nice to have people be able to read, and then if they have to go back and say, oh, yeah, that's what she said. So I have no pictures. So get your brains ready to be bombarded with lots and lots of words, because I know you're going to come back and say, what did you say? And I'll just say, go to slide number. Okay. So to start with, certification and the quest for it is not new. And so for a while, the medical physicists in Nigeria have been looking to have clinically qualified medical physicists. And the whole point is that they will ensure safe and effective use of radiation in clinical practice, both in the diagnostic and therapeutic areas of radiation. So in 2012, I believe, a residency program in collaboration with the IEAE, I think I spelled that wrong, IEAE, oh, sorry. That's wrong, I will redo it. I was embarked on, but there was quite a few challenges, and not least, one of the issues that we have that we are not recognized as a health profession in Nigeria. So in 2022, where I think more of it that last year when we began to really work on things, NAMP decided to revisit this quest for clinically certified medical physicists. And this time we looked at having a robust process or, robust processes to evaluate the professional competence of the person who would become a clinically certified physicist. So, who is a medical physicist or a clinically certified one? So it's a medical physicist who has the appropriate clinical knowledge. You need the clinical knowledge and skills and competence or experience, however you want to use the word, to practice safely and independently. And I know CPD is it's a horrible word for many people. You have to be able to demonstrate sufficient commitment to continuing professional development. That is the clinically qualified medical physicist. So what are the routes to certification? There are two routes that you could possibly go through. The first one, which we've been working on, we'll tell you a bit more about it, is the NAMP Training, Education and Assessment Program TIP. So
yes, we can hear you, ma'am.
Okay, so anyone who completes TIP becomes certified, and we put them on the Certified Medical Physicists Register for NAMP. And but at the moment, it's not available because we're wanting to certify the experienced physicists first, because they're the ones who are going to be acting as supervisors and mentors and training people in the approved clinical centers. But we expect that TIP would be a 4-year program. Now, whatever we're doing now, nothing is set in stone. There can be wiggle room, but at the moment, this is what we've got. So in terms of the experienced medical physicist, this route is still based on assessment of competency required for TIP. Again, in this, candidates chosen specialty. Now, the experienced physicist must lodge their interest by filling the application, and they need to be able to demonstrate a whole lot of stuff. They have to give us evidence of their degrees. If they've got overseas registration or certification, they need to let us know. They need to have CV detailing their responsibilities, both presently and recent past, across a whole range of domain. I'll talk about the domains of expertise later. They must have 2 referees and who would write references across the broad range of expertise. So you can't get away with finding somebody who doesn't know anything about medical physics or your chosen specialty. You need at least one person who is at a senior level who is able to write a reference for you. And we expect that whoever is going to be applying must have 6 years full-time equivalent of recent experience in a clinical center. Now, one of the things that those who are applying as experienced physicists will have to do is also to demonstrate through their portfolio some of the works they've been doing. So we expect the candidate to have 3 items of the best work from their portfolio, and they must be able to demonstrate critical thinking and thorough scientific thinking, high quality written scientific communication skills, how it's affected their workplace, their ability to think independently, and the competent scientific practice. I thought it would be nice to give an example from my experience working. When we had the tomotherapy, like I said in the intro, it was said, we were the first in the UK to have the tomotherapy machine. And the tomotherapy machine is the first, IMRT, IGRT system built from scratch. It was built to be an IMRT, image, registration system. VMAT, it's a helical, rather than VMAT, it's a helical volumetric, system. So there was a lot of pressure on us to be the example for the entire country. And my boss nominated me as the lead physicist. So we started well, lots of pressure. And then we had a problem. One of my colleagues did the patient-specific QA that failed. I was not at work. This is where professionalism comes in, and like Kelly said, you don't always get it right. You learn on your, from your failures. I got back to work and I was told, it's your responsibility. You're the lead physicist, sort it out. And we called the people from the US. We did all manner of checks and we couldn't sort it out. And then while we were discussing it, I had a light bulb moment, aliasing. The company had told us that whatever the thickness slice for your CT for the patient is, that's what it should be for your patient QA. But we had a CT system that didn't always do what we wanted. So we can use any slice thickness on the CT different from the patient. And that was where we had the problem. Tomotherapy is like a CT, the way it works. And so when you have a very off-axis treatment, you have what is called thread effect, where you have your dose undulating up and down. And that's what we were getting. So we were getting, when you don't have the same slice thickness from your patient compared with your phantom for doing QA, you will get dips and troughs. And what the planning system was doing was to do an averaging. And where you have very deep thread effect, the averaging was giving us up to 7% difference. And so we eventually then changed our protocol. But it required me to go back to my BAC days to remember aliasing in order to bring that to play in a pressing problem that we have at work. So I had to write it all up, change protocol, inform the doctor, inform other staff groups, and then we had it as a protocol. So don't underestimate those little things that bug you for you to be able to put them as a portfolio thing, so that you can say you've thought through it critically, you've written something about it, you've communicated, and it was something you did. And sometimes we do work in a group. So those are the kinds of things that we would like to see when you're writing giving us an item of your best work. Now, for the domains of expertise, we've adopted the CANDEMS, which is a Canadian framework used by the doctors for us. And it's a very widely accepted framework. So if you remember from yesterday, Dr. Sandwell talked about it. Collaborator, communicator, it's all part of what the domains of expertise are. So there are 7 domains, and the first one, which is probably the biggest, where you're going to be proving yourself the most, is the medical scientific expert. This is your ability to integrate your scientific approach, clinical knowledge, skills, and professional values in the provision of high quality and safe patient-centered care. It's all about the patient. In order to demonstrate this, you must give evidence of your CV, which is where your CV is very important, and your references and your portfolio work. So can I encourage you, if you're not used to writing things that you do down, this is your opportunity to begin to write things down. Make notes of the things you do, write them down, and think through them so you can present them for the future. Then there is the domain as a communicator. We form relationships with other healthcare professionals, patients, their relatives, in order to get information that we share, for effective healthcare. For this domain, what you need to do is self-reflection of examples where you have acted in this capacity. And this is why, again, I said you need to write things down that you do. And one of the things that I find very interesting in working in radiotherapy, people don't see us, and occasionally they may see us come to the machine. And from time to time, when therapy, we call them radiographers in the UK, when they're stuck with information to give patients, they say, we have physicists. So they drag you out of the planning room or from wherever your office is to come and speak to a patient. And that's when we found that, patients actually want to hear us, and we can actually help them. So we had a patient who said, yeah, when I get on the machine goes around and I don't hear any tick, 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 tick. Then the next time I get on the machine, I hear tick, 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 tick. And I thought, yeah, the first one was imaging, the next one was treatment. And they said, can you show us pictures? And so we decided to do something to help the patient understand what's going on the machine. Now, this is something that physics people, it seems mundane, but these are the things that we can help to keep the patient compliant. Sometimes I show them pictures of what their bladder looks like. I give them a generic image, and I say, so if you don't drink, your bladder goes into your treatment. So they have images of what they can, we can do. So it keeps them compliant. So we can communicate better with it, either by talking with them or actually by producing some document that would help them, and it affects and improves their treatment in a sense. So collaborator is another domain. And again, we work effectively with other healthcare professionals to provide safe, evidence-based, high quality, again, patient-centered work. Again, it's something that has to be done using self-reflection. So please keep writing things down that you've done. Medical physicists are expected to act as leaders. So we engage with others to contribute to the vision of a high quality, again, evidence-based healthcare system. And we take responsibility for the delivery of excellent patient care through the activities that we do as scientists, administrators, scholars, teachers. And again, this is something you do as a self-reflection. So keep writing those things down. I remembered, for those of you who attended, I think it was last year, I did a talk on trying to get your management to buy into what you do as a medical physicist. And we did a physics day. Again, this is a time that you can, engage with people and teach them what they need to know about physics and show leadership in that area. Healthcare advocate is another domain. Again, we contribute to the what influences the work that we do by communicating with patients and improve their healthcare. We work with those who serve that we serve to determine and understand their needs. Again, I've talked about that in talking to patients, and we speak on their behalf. And so we tell doctors, sometimes the patients don't know what to say, and we are the ones who understand what they're saying to us in the clinic, and we get the doctors to buy in and to support and mobilize resources to change things for them. Again, this is something that you have to do through self-reflection. So write those things when patients accost you along the corridor and speak to you, or relatives of patients or other staff groups. This is the time that you need to put things down in writing so you can add it to your portfolio. So medical physicists are scholars, and this is where many of us think we're so busy, we don't have time to do continuing professional development. You cannot do your job well if you're not constantly learning. I remembered I'd been in the profession for 20 odd years and haven't moved to tomotherapy, which is a different type of LINAC. I'd forgotten a little bit more about my conventional LINAC. And as part of my CPD, I said to my boss, I want to revisit my understanding of conventional LINACs. It's a self-study, which I did. And a few years later, I found myself working with the Variant Edge, a conventional LINAC. So we can do all manner of things to try and get our continued development. We continue to development, looking at different things to help us learn better. And as professionals, again, it's something that we don't often do, and I'm glad that other speakers have talked about it. Jason Tofin was talking about do not lie. It's something that one of the things we bring into our practice, ethical practice, high standards of behavior, accountability. And those are things that we need to focus on. And sometimes, I don't know how many regulations we have in Nigeria, but in the UK, we are very key on ensuring that we work within our regulations. So again, let's get to know what the regulations are in the country so that we're working within them as professionals. Okay, once you've put in your application stating all that we've discussed so far, then assessors who have been appointed by NAMP and who are themselves experienced medical physicists in the area that they're going to assess will take all of the work that has been produced, the applications, and perform an assessment of it. So assuming that the candidate has sufficient evidence to prove and demonstrate that they're suitable for certification by their level of competence, then the assessors will choose one of the 3 items from the portfolio. They will let the candidate know and say, look, you can now proceed to what's called the safe to practice interview. So you will know about this one topic or item of your portfolio that you've given before the safe to practice interview. Now, if the candidate is unable to provide suitable and sufficient evidence, the candidate may immediately proceed to refusal, rejection, or dismissal. I'll talk about the various results that you can get later. So in the safe to practice interview, The assessors will discuss the candidate's experience. They will discuss that item of portfolio, and they would ask questions about different areas of the person's practice. Now, I know in Nigeria that people practice for years and years, and they may not actually have machine, or planning systems, that they're just at work. And so in times when we have people who have greater than 10 years post-university experience, but they have limited evidence to support their statements of knowledge and experience, this candidate will maybe offer the opportunity to demonstrate their knowledge and experience in an extended safe to practice interview. For those who find themselves in that, we can talk to them later about that. Now, there are various answers that you can get from your application. You can be approved, and you have sufficient experience, knowledge, skill, professionalism to meet all the requirements of the NAMP certification through the team. And we say, congratulations, you're registered, and now you can fly solo. And but one of the caveats we are going to put in for the first cohort of people who are going to get certified is that you need to give back. We talked about jackpotting, and what we don't want is for people to say, I am now certified, I'm going to jackpot and leave us in need of people. So we want you to bear with us. You have 12 months in which you need to prove to us that you have taken part in education, training of residency candidates, our junior colleagues who are seeking NAMP certification. There could be refusal. Now, if the candidate does not meet all the requirements, then the NCCB can ask that they give them a prescribed work, and over a period not more than 12 months in which they're going to go back and do some extra work and come back. And a brief further discussion with the candidate may follow the submission of this prescribed work. And if they pass, then they go on to be certified. If the prescribed work is not satisfactory, unfortunately, that means a rejection. And a rejection is that a candidate requires additional guided training under supervision and is encouraged to consider applying for NAMP certificate through TIP. And but of course, you have to meet the enrollment criteria for TIP. And the person is not allowed to reapply for certification within 12 months. Now, the last kind of result a candidate may get is dismissal. And dismissal simply means that the person does not even meet the criteria for training. And so that's it, you're not doing it. So a very out of the way example is somebody with an English degree saying, I want to do certification. Not possible. Okay. Now, I've said a lot of things, and I know it's a lot of words. And now I would like to hear what you guys have to say. So thank you for listening. And if you have any questions, please shoot.